This is Chapter 18, Diet and Health. These are your learning objectives. Nutrition and infectious diseases. Infectious diseases. Diseases caused by bacteria, viruses, parasites, or other microorganisms that can be transmitted from one person to another through air, water, or food, by contact, or through vector organisms such as mosquitoes. Examples include the flu, pneumonia, strep throat. Our ability to diagnose, treat, and prevent these has improved. We also have vaccines and antibiotics now, and purified water to help keep us healthy. Strong immune system depends on adequate nutrition. Immune response requires greater amounts of nutrients. Poor nutrition weakens the immune system. Immune system responds to changes in nutrition status. Overnutrition and undernutrition both have effects. Undernutrition does not provide all of the necessary nutrients, while overnutrition leads to chronic inflammation, which causes other issues we'll talk about later in this chapter. Inflammation and chronic diseases. Immune system response to infection or injury is inflammation. This is an acute response. Acute meaning short-lived or the immediate response to infection or injury. It's how your body heals. Blood supply increases to the site. Vessels become permeable. Phagocytes engulf microbes, release oxidative molecules to kill microbes, and fights off infection and promotes recovery. Now moving on to chronic inflammation. It's harmful, and chronic inflammation often occurs with obesity. This type is harmful because it persists for a long time or is reoccurring. 10 leading causes of death in the United States. 4 out of 10, or about 40%, are associated with diet and lifestyle factors, specifically heart disease, diabetes, stroke, and some cancers. Interrelationships among chronic diseases. Note that obesity has a link to all chronic diseases. So basically, by link, I mean a risk factor. Many of these chronic diseases are also risk factors for other chronic diseases. So diabetes, you can see, has an arrow to atherosclerosis. Atherosclerosis has an arrow pointing to hypertension, and hypertension pointing back to atherosclerosis. And in the bottom right corner, you can see stroke and heart attack. And that's not linked to obesity because they are acute events as a result of the chronic illness. I ask that you pause this presentation for a moment and try to answer the questions. Cardiovascular disease, disease of the heart and blood vessels. Cardiovascular disease is the overhead or umbrella term. Coronary heart disease is a type of cardiovascular disease. This section will mostly talk about coronary heart disease. So, coronary heart disease, or CHD, caused by atherosclerosis in the coronary arteries that supply blood to the heart muscle. Atherosclerosis is the accumulation of lipids and other materials in the arteries. It's the most common form of cardiovascular disease. Atherosclerosis, the accumulation of lipids and other materials in the arteries to form plaque. Abnormal blood lipids are a major component. It's also known as the hardening of arteries, and it's a major contributor to CVD, or cardiovascular disease. The progression of atherosclerosis starts as fatty streaks with continued buildup of cholesterol, other lipids, and calcium until they form plaque. Plaques stiffen the arteries and narrows the passageway. Plaque is perceived as tissue damage, which increases the inflammatory response. This is somewhat of a continuation of the last slide, where plaque signals the inflammatory response. So the immune system sends macrophages. It's like a white blood cell, essentially. Macrophages engulf LDL cholesterol and eventually become plaque. Free radicals are produced, and it leads to further cell damage. So the immune system responds by sending macrophages, and macrophages are a part of your immune system. They work by ingesting and destroying foreign antigens or threats to your body. Arterial damage and the inflammatory response favor the formation of blood clots. Clots enlarge, further decreasing blood flow to tissues. When you have a cutoff of blood supply, it leads to a heart attack or stroke. So blood supply is either cut off by either a blood clot or plaque breaking off and blocking an artery. If the blood flow blocking the heart, it's a heart attack. If it's blocking the brain, it's a TIA or a stroke. I ask that you pause the presentation momentarily before I reveal the answers. Listed are the risk factors for coronary heart disease. So you have modifiable factors, which you can change, and non-modifiable factors, which you cannot change. So on the left, you have your modifiable factors, or factors that you can change. And that's your HDL cholesterol, or high LDL cholesterol, low HDL cholesterol, high blood pressure, diabetes type 2, obesity, physical inactivity, cigarette smoking, and an atherogenic diet. Atherogenic meaning likely to cause atherosclerosis. And then on the right-hand side, you have your non-modifiable risk factors, which you cannot change. And that's your increasing age, male gender, and family history of premature heart disease. Standards for coronary heart disease risk factors. So here are the desirable, borderline, and high-risk ranges of blood lipids. You may see slightly different ranges from other sources, but generally they're pretty close to each other. So non-modifiable risk factors, age. As your age increases, your risk for coronary heart disease rises. It's a significant factor at 45 for men and at 55 for women. Gender, men have an earlier onset of risk factors. Early coronary heart disease in immediate family members. So you have a greater risk the more family members are affected, and greater risk the earlier age of onset. People with high genetic risk can improve the odds by living a healthy lifestyle. High LDL and low HDL cholesterol. So total blood cholesterol has a strong correlation to atherosclerosis. So you want levels to be within desired limits to help lower your overall risk. LDL is the most atherogenic lipoprotein, meaning it's most likely to lead to the development of atherosclerosis. The higher the LDL, the greater the risk for CHD. Adequate levels of HDL are beneficial. Higher HDL may or may not provide added benefit. Higher HDL levels are not proven to be beneficial, so just make sure it's in the desired range. Low HDL can contribute to the development of atherosclerosis, and high blood triglycerides promotes atherosclerosis. High blood pressure and diabetes. These are also risk factors for coronary artery disease. Chronic hypertension. Even slightly elevated levels increase the risk of heart disease. Injures the artery walls, which leads to accelerated plaque formation, and that increases blood pressure even further. As far as diabetes, it increases the risk of death from coronary heart disease. Other risk factors. Obesity and physical inactivity can lead to high LDL, low HDL, hypertension, and diabetes. It increases the risk for coronary heart disease. Weight loss and improving fitness decreases your risk. Cigarette smoking. Smoking directly damages the heart, and it damages the heart by increasing blood pressure and increasing the workload of the heart. Toxins also damage blood vessels. Atherogenic diet. So diet high in saturated fats, high in trans fats, low in fruits, vegetables, and whole grains. This elevates LDL cholesterol and is associated with metabolic syndrome. Metabolic syndrome is a combination of risk factors: insulin resistance, high blood pressure, abnormal blood lipids, and abdominal obesity that greatly increase a person's risk of developing coronary heart disease. Abdominal obesity and insulin resistance. So specifically, these two factors are considered the primary factors contributing to metabolic syndrome. Early treatment focuses on lifestyle changes. So now moving away from coronary heart disease and onto hypertension or high blood pressure. Blood pressure results from cardiac output or contractions in heart muscle that pump blood away from the heart. Peripheral resistance is the resistance blood encounters in the arterioles, or the small arterial branches that carry blood to the tissue. With an increase in either cardiac output or peripheral resistance, blood pressure rises. Hypertension risk factors. Aging. Hypertension risk increases with age. Genetics. Obesity is a major cause of high blood pressure. Salt sensitivity, so reducing salt intake can lower your risk. And alcohol consumption, so regular consumption of greater than 2 drinks per day. Hypertension treatments. The first crucial step is actually checking your blood pressure to know if it's even high. Weight control. Maintaining a healthy body weight can decrease your risk of hypertension. Following a DASH diet or low sodium, so decreasing your salt intake. You also want to remember that a DASH diet is high in fruits, vegetables, whole grains, low-fat dairy, nuts, and seeds. It's low in salt and saturated fat and high in potassium. Physical activity can lower blood pressure and control mild hypertension without medication. And then with medications, usually meds include diuretics to get rid of extra fluid, therefore decreasing blood volume and subsequently decreasing blood pressure. This can lead to a potassium deficiency, so you want to make sure that you're eating plenty of fruits and vegetables. Moving on to diabetes. Incidence has risen dramatically. Prediabetes, elevated blood glucose, but not to the extent that it can be classified as diabetes. 7th among leading causes of death, and contributes to several other major diseases, including heart disease, stroke, hypertension, blindness, and kidney failure. Diabetes is characterized by high blood glucose concentrations and disturbed insulin metabolism. Hyperglycemia is elevated blood glucose. Diagnosis of diabetes. You check fasting plasma glucose, and this measures a person's plasma glucose after they have not eaten for at least 8 hours. And then a non-fasting A1C. This measures the percentage of hemoglobin with glucose attached to it. The higher the percentage, the higher a person's blood glucose levels have been over time, roughly about 3 months. Type 1 diabetes. The pancreas loses ability to make insulin, and it's an autoimmune disorder. Type 2 diabetes is insulin resistance or cells reduced sensitivity to insulin. This slide compares type 1 diabetes versus type 2 diabetes. Type 1 typically has an earlier onset and is less prevalent. There is no cure. The issue is that the pancreas does not make insulin. Type 2 diabetes can be reversed. Diet and exercise play major roles, and the issue is that cells become resistant to insulin, and therefore blood glucose does not enter the cells and blood glucose remains high. It's no longer called adult onset with the rise of childhood obesity and the child diagnosis of type 2 diabetes. I ask that you pause the presentation momentarily to try to answer the questions. Complications of diabetes. In both types of diabetes, glucose fails to gain entry into the cells, leading to accumulation in the blood, so high blood glucose levels. Chronic complications include cells convert glucose to sugar alcohols. That can cause toxicity and cell distension. Distended cells in the eyes can cause blurry vision. Cells attach glucose to proteins. So you have the hemoglobin A1C test, and this alters protein function, which leads to other problems. You have a loss of circulation and nerve function. Infections, so poor circulation combined with glucose-rich blood and urine increases your risk. Diseases of large blood vessels, remember atherosclerosis and its role in coronary heart disease. Diseases of small blood vessels, so it damages capillaries and can lead to loss of kidney function and loss of vision. Diseases of the nerves, so may feel pain or prickling sensation. It eventually leads to a loss of sensation in the hands and feet. Recommendations for diabetes. Carbohydrate intake. So you want to deliver the same amount of carbohydrate each day and space carbohydrate intake evenly throughout the day. Preferred sources are listed here. You want to avoid carbohydrate sources with added sugars, fats, and salt. The more fiber and the less processed, the better. Recommendations for diabetes. So diabetes and heart health go hand in hand. Recommendations for dietary fat. They recommend that you follow the dietary guidelines for Americans, reduce saturated fat intake to less than 10% of total calories, limit trans fat as much as possible. Omega-3s are beneficial. It's beneficial for heart health in diabetes and it's beneficial for heart health in the diabetic population, but also the general population as well. Protein, you want an individualized goal. No ideal intake has been determined. Alcohol, similar guidelines to the general population. So moderation is okay. 1 drink per day for women or 2 drinks a day for men. Recommendations for type 1 and type 2 diabetes. Type 1 diabetes. Adjust insulin doses to accommodate meals, physical activity, and health status. Normally, your body adjusts production for you. Type 1 diabetics have to do this manually. Carefully coordinate diet, physical activity, and insulin regimen. Type 2 diabetes. Moderate weight loss, even weight loss of 5 to 10% can improve insulin resistance, blood pressure, and blood lipids. Regular physical activity also improves blood glucose control, blood pressure, and blood lipids. Moving on to cancer. Cancer, growth of malignant tissue from abnormal and uncontrolled cell division. Factors that affect cancer development. Diet, processed diet versus plant-based foods. So diets high in fruits, vegetables, whole grains can prevent cancer, while excessive consumption of red meat, alcohol, and processed meats increase your risk. Foods high in salt and saturated fat also increase your risk. Environmental factors such as exposure to radiation and the sun, water and air pollution, and smoking. Body fat percentage. Physical activity may have a preventative factor for cancer due to its role in weight maintenance and in preventing obesity. Reducing cancer risk. A diet rich in fruits and vegetables contains nutrients and phytochemicals with antioxidant activity. These may prevent and reduce oxidative reactions that damage DNA. These may also enhance immune function that is protective against cancer development. This diet pattern is also rich in fiber, which is protective against cancer. Fiber is thought to help by binding, diluting, and rapidly removing potential carcinogens from the GI tract. Physical activity helps maintain a healthy body weight and reduce risk of some cancers. Recommendations for chronic diseases. You want to balance food intake with physical activity. Dietary recommendations support each other, so what helps prevent one chronic disease helps prevent the others. Weight control. Lose weight if necessary, and it can decrease your risk for all chronic diseases. The healthy eating plate. It's based on review of links between diet and health. This is basically like my plate, and we'll look at it on the next slide. Stay active. Physical activity is good for your heart muscle, blood pressure, blood glucose control, and weight status. So here is the healthy eating plate, an alternative to the USDA MyPlate, but you can see that it is pretty similar. You want to make sure that you're incorporating plenty of fruits, vegetables, whole grains, lean protein, uh, hydrating with water, and consuming heart-healthy fats. You want to avoid beverages that provide a lot of sugar, choosing heart-healthy fats like olive and canola oil, as well as nuts and seeds, and just overall avoiding excess calories, as well as saturated fat and added sugars. And this concludes Chapter 18, Diet and Health.